Hey, I'm Dr. Michael Thomassen from Nebraska Equine, and today I was going to talk to you a little bit about sedation. So we sedate horses on a daily basis for a variety of reasons. It may be something as simple as for the farrieing, or for pulling a mane, or cleaning a sheath, or it could be something more medically driven like floating teeth, doing a biopsy or rectal exam or something like that. But we have a lot of reasons for sedating horses, and a lot of you may have not ever seen a horse sedated, and so when we come out and we tell you that we're going to sedate your horse, there's sometimes a little bit of anxiety, and rightly so. So my goal here today is just to briefly talk about what you can expect with your horse once it's sedated. So we use standing sedation again for a lot of reasons. So it is really common for us to do it. It'll involve either, most of the time, an intravenous injection, but there are also an oral sedative that you can use, and sometimes we'll give them an intramuscular sedative as well. So most of the time it's an intravenous sedation, and it will take effect within 30 seconds to about 2 minutes. And so what you can expect initially is that your horse will get really, really relaxed. You'll see his ears droop, head kind of come down, get a really relaxed demeanor, and then you'll notice that when he's standing there, he or she is standing there, that they'll get really wobbly, and so you'll see them and you'll think that they're going to go down. That's a really common reaction out of both the horse and for you guys seeing it for the first time. Really common to think that they're going to go down. Very few horses ever lay down from sedation, and so it doesn't happen very often. It's something to consider, but most of the time it won't. So once they're sedated, we'll do whatever procedure we're there for, and then we'll leave. I think the biggest thing with sedation is having them in a level, safe environment so that they're not standing on a hill. They could fall down there. Or having them on a slick floor when they try to walk and they're very uncoordinated, they could easily fall there. Fasting prior to sedation is usually not necessary, but fasting after sedation is absolutely essential. So horses will think they're ready to eat before they are, and they'll actually choke or get an esophageal obstruction. And so it is a big, big issue, and we need to make sure that the horse is held off of feed until they're fully awake. Coming out of sedation, some horses sweat profusely, some horses sweat a little bit, and some horses don't sweat at all. So any of that spectrum there is considered normal. And most of the time, within an hour and a half to 2 hours, you don't even know that your horse is sedated. I, as a general rule, don't like the horse to be worked or ridden for about 24 hours after, but the effects of sedation are going to be gone within an hour to 2 hours. So those are some things to think about when we come out and sedate your horse, and some things to hopefully make that first experience a little bit easier. So next time we sedate your horse, you can know what to expect.